Hi, I'm Dr. Diego Ruiz Dasilva, and I'm a senior dermatology resident at the University of Pennsylvania. Today we're talking about sunscreen. The most important thing about sunscreen is actually not the brand, it's how broadly it acts. So when you're looking at the bottle of sunscreen, you want to make sure it says broad spectrum on it. Mineral-based sunscreens are most effective at blocking UVA and UVB. Tinted sunscreens are gaining popularity because there's growing evidence that blocking visible light, which is not blocked by traditional sunscreens, is really important to decrease negative effects of the sun on the skin. The higher the SPF is better. Although many dermatologists tell their patients that wearing SPF 30 is enough, the studies that recommendation comes from had patients using SPF 30 sunscreen in thick globs all over their body and reapplying every 2 hours. That is just not realistic. So I say the higher the SPF, the better. There are plenty of sunscreen with SPF 70, even 100 and higher that are gonna give you more benefit and allow you to have a better experience outdoors without having to worry about reapplying or about putting on a thick amount that is just inelegant in appearance. That's not to say that you shouldn't reapply, that's important, but we wanna be realistic in that a lot of times it's impractical or people forget, and so I wanna give you the best chance to protect your skin. Lastly, sunscreen should be worn every day, not just during beach days or outdoor activities, because the UV rays from the sun actually penetrate through glass in your home or glass in your office, as well as the window of your car. And those rays still cause aging and damage to the DNA in your skin. So many of you may be wondering, what's the difference between a physical blocker and a chemical blocker? So a physical blocker, also known as a mineral blocker or mineral sunscreen, has compounds that physically block the sun rays from reaching your skin, such as zinc oxide or titanium. Here are a couple of great examples. The main downside to physical sunscreens is that they can often look thick, white, or pasty when put on the skin, making people not want to wear them, even though they're great for you. Several companies have tried to combat this by making them more cosmetically elegant. Elta MD is a great example. This goes on fairly clear and you'll barely even know that it's a physical blocker. Chemical blockers contain chemical compounds that absorb the sun rays and therefore do not allow them to reach your skin. They are great, but not as effective as physical blockers. There's also some evidence being reviewed by the FDA that chemical sunscreens are absorbed into your blood. There's no evidence that this is harmful, but it's something that many people have on their minds and is therefore increasing the popularity of physical blockers. One of the reasons they're not as effective is because they more easily come off compared to the physical blockers. But that is also the reason they're more cosmetically elegant and you normally can't notice when someone is wearing them. Another common question is, which vehicle is the best? Is it better to use a cream, a lotion, or a spray? Well, there's no one size fits all. Each has their own advantage. Dermatologists love the creams and the lotions because they spread evenly on the body and provide a thick layer of security. The sprays, however, are much more convenient to use because you can quickly spray them all over. The main problem with these is that people often don't rub them evenly after spraying, and they also come off a little bit more easily in the water or with sweat. I'm a pragmatist, so in my opinion, the best sunscreen is the one that the patient will wear. So I often tell my patients to try several different sunscreens and choose the one that makes them feel most comfortable. Another thing I want to talk about today is sunscreen for kids. So for kids, physical or mineral sunscreens are highly recommended. That's because an infant's skin is much thinner than an adult's and can absorb topical compounds easily. There's no direct evidence that chemical sunscreens are harmful to young ones, but to be particularly safe, we recommend physical sunscreens, especially for little ones under 6 months like this little girl. The best thing about sunscreen is that it helps prevent skin cancer. But I know a lot of you are wondering, what can I do to prevent wrinkles? And doesn't sunscreen help with that too? It does. So tune into my next video to find out how sunscreen and a couple other things can really prevent those wrinkles. Well, I hope you liked this video, and if you did, please hit that like button below and subscribe. And please let me know if you have any topics that you'd like me to discuss in future videos.